Well, hello everybody. It's been a while since I did a live, so I thought it was about time I came and said hello to you all. I'm just jumping on as well so I can see that, make sure I am actually live and to see if I get any comments. So, as you can see from the title today, we're looking at fillers. That's lip fillers and all types of dermal fillers, but obviously the most common one and the one that people think about most is lip fillers. In case anybody's asking, yes, that does say shite shirts, in case you were wondering. My new work uniform consists of these really rather fabulous shirts with all different coloured panels on them. I just figured it's more interesting than a normal clinical uniform. So, but anyway, those of you who don't know me, I think most of you who follow me do know me now. I'm Sally and I am a registered nurse and I offer a whole range of aesthetic treatments. But the thing we're talking about today, and the thing that most people have heard about, and that the thing I seem to get the most questions about, is lip and dermal fillers. It's a really common treatment to ask for, and it's growing all the time in the aesthetics industry. Lip fillers, so fillers and botox are the biggest part of the aesthetics industry. It's growing at a huge rate, and it's starting to be seen a little bit more commonplace than perhaps it used to. I think there's so many people having it now that people tend to see it as not necessarily that big a deal, which isn't actually necessarily a very good thing. Excuse me. I have based this live on around the questions that I get asked most. If you've been on my website lately, I have answered all of these questions as separate blog posts, because they're all relevant and everybody wants to know different things about them. But it's been such a long time since I came and did a live that I thought it was about time I came and addressed some of these things, given all the questions that I generally get about them. I think the biggest question that I get asked, and the thing that almost everybody, not everybody asks me, but almost all of my clients ask me is, are lip fillers safe? The people who don't tend to ask are the people who've had them before and perhaps are a little bit more comfortable with having them. Safety absolutely should be the first question that is asked about lip fillers, or about any type of fillers, and indeed about any kind of aesthetic treatment that you're having. You need to know the safety of them and how safe is your practitioner. So the short answer to the question, are lip fillers safe, is a cautious yes, and I'm cautious for the following reasons. The product that most lip fillers are made of, which is hyaluronic acid, and I'll come to that in a minute, is very safe inside the body. Our own bodies make hyaluronic acid. We have hyaluronic acid in our skins, and hyaluronic acid is really, really important for holding on to hydration. When someone says to me they drink loads of water but their skin's still really dehydrated, it doesn't matter how much water you drink if you don't have hyaluronic acid to hold on to that water. So there are various ways of increasing the hyaluronic acid in your skin. And one of those ways is with dermal fillers. And lip and dermal fillers are used in various ways. One of them is to create volume. We all know about big lips that are out there. Lots of people have big lips and lots of people want that. Lots of people want the volume in their lips. They're also used for smoothing out sort of deeper lines and wrinkles. You can do your nasolabial folds, you can fill that. And a lot of the time it's to replace and restore lost volume. And this is where I have the most interest, if I'm honest. And for me, it's about replacing volume that is lost as we age. So for example, I tend to go for cheek fillers before I go for nasolabial folds. If you put your coat hangers back in, you put the stuff that we lose as we age, because we all do, you put that back in here, and you can actually, you see straight away, if I sort of do that, which would kind of shows what would happen if we filled the cheeks, it actually lifts this line. The light is terrible in here, I apologise for that. So things like cheek fillers are about replacing lost volume, because as we lose volume, gravity takes on. If I push down, look, because we lose the volume, you can see what happens to nasolabial folds and marionettes, the mouth lines. So replacing volume is the biggest thing for me as far as fillers go, and it's the thing I focus on most before anything else. For example, if I'm doing any kind of filler around the mouth, I would invariably put a little bit in the top lip, even if we're not doing lip fillers. So, you know, a lot of people come to me just for lip fillers because they want to replace volume, they want to improve the shape, they want a better Cupid's bow, they want to even out asymmetry, they want to just increase the volume and improve the shape and all that kind of thing. But actually, if we're looking at things like smoker's lines and marionettes, because we lose volume everywhere, this is men and women, actually just by introducing a little bit into that top lip can really make a difference without sort of big borders and big, you know, sort of plump lips or anything like that. So back to the question, are lip fillers safe? I am a registered nurse, which means before I even started doing any aesthetic training, I did all of my nursing qualifications, degrees, and all the courses surrounding that. And I had been nursing for 20 years before I even started doing aesthetics. So what medical people have when they go into aesthetics is a lot of background. And one of the reasons it took me such a long time to get into the aesthetic side, particularly the injectable side, is because I very fully understood what it was I was taking on. So fillers, dermal fillers, lip fillers, injectable cosmetics are very safe when they're done properly by somebody who understands what they're taking on, has the right training and right experience, but also an understanding of you know, how serious what it is that they're taking on. So while lip fillers are quite a routine thing for me to do, I totally understand, you know, the sort of medical side and why it's important to do them properly. I understand what it is I took on when I decided to train in fillers. I love the creativity of fillers. If they're done properly, they are very safe. And like I said, hyaluronic acid as a substance is very safe as well. We all hear the horror stories. And in fact, we hear more horror stories than we hear the good stories because that makes better media, makes better articles to read, makes better telly and all that kind of thing. And generally speaking, it puts a lot of people off, that kind of the scare market of, you know, infections, occlusions. So an occlusion is where hyaluronic acid filler is injected into a blood vessel. There are lots of blood vessels around the face. I might be able to show you some. And if it's not done properly, there you go, there's a network of blood vessels that runs around the face. So if you think you've got your labial artery here, you've got another big artery that runs, that's really hard to do this back to front. I can't do it back to front. It's a really big artery that comes here, and then when you're doing cheeks, you've got different arteries to contend with, blood vessels to contend with here. You don't want to inject filler into that. And so it's really important to have an understanding of the face, of the blood vessels, and the areas that we're looking to inject into. The training we should all undertake should cover all of those things. It's not just about the safety of having the treatment. What's also really, really important is how your practitioner manages something if it doesn't go according to plan. The most experienced, the best injectors can have occlusions. And the important thing now is what happens next. All of my clients sign to say that if they are concerned about anything after their treatment, after they've left my clinic, I am the first person that they will contact. The last place you should go is A&E, certainly initially, for various reasons. I know where I've put your fillers, I know what product I've used, and I have the products here in the clinic to dissolve them if there is a potential problem with them. In A&E, that's not their job. First of all, this is a private treatment. They don't take very kindly to people turning up with those kind of problems, and they're not necessarily as equipped to deal with those problems, whereas we are. If there was something very, very serious, if, you know, worst case scenario, I would travel with my client to an emergency department. But the chances of that happening are very, very remote. The right products, the right training, the right emergency care, the right aftercare should reduce all of those risks. The problems come when people aren't properly trained in aftercare or even in the treatments themselves and don't perhaps understand the seriousness of the treatments that they're performing, and don't know how to deal with the problem that arises if it were to arise. And we've all read articles about people being blocked on social media, being blocked on messages because they've gone, I've got a problem, I don't know what to do about it, this isn't normal, and that person disappears. I'm not saying all practitioners are like that, and all practitioners who aren't medics are like that. There's some very responsible people out there. But these are the things to look for, and these are the things that make it unsafe. We all hope, as practitioners, we don't ever get an occlusion, but it does happen. Like I said, even to the most experienced injectors, it can happen, and that's why we are trained in how to deal with those issues. So, to answer the question, are lip fillers safe? The cautious, yes. If they're done properly by the right people and managed properly after the event as well. So the next question that I looked at was, are lip fillers permanent? And that also tied into the next question, being, can lip fillers be removed? So they kind of can be answered together, really. So are lip fillers permanent? No, there are permanent fillers out there. One of them is called Aquamid. I believe it's not something I use. I use temporary hyaluronic acid based fillers. These are designed with sort of products that mimic our body produces itself. We produce our own hyaluronic acid. So hyaluronic acid is crossing, which means it's formulated in such a way that it's not just going to disperse. It's going to stay where we put it until the body naturally breaks it down. So there are permanent types of fillers. They're not something that I use or plan to go into. And semi-permanent types of fillers as well, which last, so they obviously last a bit longer than the hyaluronic acid ones. Hyaluronic acid fillers, if they're not quite, if you sort of get a few weeks down the line and they've been put in properly and safely and there's no problem, you just don't like them, you have two options. So this is where we're looking at can fillers be removed. The two options are leave them and let them dissolve on their own. Fillers tend to last between 6 and 18 months, depending on where they are, your personal metabolism. So some people break them down much more quickly than other people. Certain skin treatments, laser treatments, radio frequency, those sort of things can break fillers down more quickly. And even hot temperatures and that kind of thing can help break them down more quickly. So you can just leave them to come out on their own, which eventually they will. Or you can have them dissolve. There's a product called Hyalase, which will break down the cross-linking, it will break down the way the product is formulated, and then it can be dispersed very quickly. And Hyalase does break hyaluronic acid fillers down very quickly. Excuse me. So there are other types of temporary fillers as well. Hyaluronic acid, there's collagen ones, and one that I can't pronounce, calcium hydrox. I got this earlier. Hydroxyleptite. No, it doesn't matter. It's a calcium-based one. There's a collagen-based one, but most commonly temporary dermal fillers, which are what you get when you go into your average aesthetic clinic and ask for fillers, are hyaluronic acid-based. I do actually have two here to show you. The main brands that I use, at least at the moment, are Juvederm and Kysense. I can show you these because the way these are packed. So Kysense comes in packs of 4, and they are sealed, and each of those syringes has 1 ml of 1 ml of filler in with a sterile needle. It's all sterile and connected, and these are opened only when they are used. And Juvederm comes similarly sealed. Juvederm comes with 2 needles. I find the Kysense needles are a little bit sharper, so I tend not to need to change them. But that's how they come packaged. No one should be drawing up dermal fillers. They are pre-drawn syringes and generally very safe to use. I'm just checking I've got no questions. No, I've got a few. Hi everybody who's watching, by the way. One of the other questions, so these are drawn down from questions that I'm asked regularly, and also actually researching online what the most common questions asked actually are. And one of them is, how are lip fillers done? So what happens when you have lip fillers done? And obviously this process is the same for any types of fillers, whether it's cheek fillers or nasolabial folds, jaw fillers, tear troughs, whatever it is. Lip fillers are done by using one of these syringes, marking up the face where necessary, because you've got landmarks like blood vessels and things that would need to be taken into account, and also anatomical correctness. So when you look at somebody, it's very creative. There's a real art to fillers, because you want to get them in the right place to get the right result for that person. So I've got a white makeup pencil that I tend to mark up with. So with cheeks, you would draw lines across from different parts of the face to somewhere, to different parts to get different points. So for cheeks, I'm usually looking at 3 to 4 points across a cheek. And when I had my lip fillers, actually there was 6 points that I had across the cheeks. So you mark them up to make sure that the fillers are inserted in the right way. And there's different ways of doing it. I use needle technique, which means you can do boluses. So a bolus is a blob, basically. So you go in and you put a bolus in. Or you can do little threads. So throughout the lips, for example, or if you're doing lines into the lips, you literally do you insert the needle and you just do a little thread back. And you're using really, really small amounts of product. 1 ml, as you can see, compared to my hand, is not a huge amount of product. But it can give a really dramatic result and a really nice result for the sorts of treatments that I want to do. If someone comes to me and says, I want 2 ml in my lips, we'll start with 1, because we want to get the shape. You build up to 2 ml. I would do 1 and then maybe another half or another 1, depending on how they looked, how they felt, and what the client wanted to achieve. The best way to get the best results on things like lips is to do them gradually. If you just go and put 2-3 ml in lips, in one sitting, that's when you get problems. It's when they look odd, they look lumpy. It needs to be done gradually. So lip fillers are done by using you can use a topical anaesthetic cream. So most fillers have a local anaesthetic also within the product themselves. Kysense don't. The reason they don't is because a lot of the swelling that you get after having fillers is caused by the local anaesthetic itself. So with Kysense, you don't get as much swelling after a treatment, but everybody's slightly different on what they prefer to have for their treatment. And like I said, we decide what the client wants. We look at the shape of their natural lip. We look for any asymmetry and what it is we can achieve. So if someone comes in and says, I want this, this and this, and their anatomy isn't set up for that, you can't achieve the same look on every person. And even if you could, it wouldn't necessarily suit their shape, face shape, their structure, their anatomy. So it's about achieving what the client wants without compromising how they look. It's got to look natural, it's got to look good. And that is a very subjective term as well. Everybody likes different things. I tend to not like the very big lips. Some people want them bigger. And it's about doing it safely and properly and appropriately for their age as well. So for men, for example, I would do very different lip fillers to what I would do for women. And for my older ladies, sort of in their 40s, 50s, 60s, I would do very different fillers to what I would be considering in their 20s and 30s. I wrote a blog article, it was actually in the press a few months ago, looking very much at the difference between injecting under 30s and over 40s. The 30 to 40 bit is a little bit of a grey area in comparison. But when we are injecting fillers or even Botox into somebody who is under 30, we are fundamentally changing how they look. Now, if it is for correcting asymmetry, for example, or just putting a little bit of volume into a top lip, that's one thing. But if we are doing sort of a lot of cheek fillers and lip fillers and jawline fillers into somebody under the age of 30, it is very much fundamentally changing their natural face shape. If we're looking at over 40-year-olds, what we're doing there, or generally how I look at fillers, is it is fundamentally replacing what's been lost with aging. We lose a lot of our fat pads, our bone density changes as we age, and the fillers I tend to focus on is about trying to replace what has been lost with aging, or put things back into where it should be because of aging. And it's a really different focus for me. I'm never going to make somebody who's 50 look 20, and nor would I try. So this is also starting to answer my next question as well, which is, can lip fillers look natural? And yes, they absolutely can. a lot of my clients going out and you'd have no idea they had lip fillers at all, or any fillers come to that. And that's exactly the sort of treatments that I like the most. It's the ones that I try and do the most of. It isn't about other people being able to see that you've got fillers. It's about it's about improving confidence for the person in front of me. I recently had a lady, really lovely lady, and she spent a lot of time sort of hunched over and talking with her hand over her face. She had 1 mil of filler into what we call smoker's lines, whether you smoke or not, and a little bit into her top lip. And the next time I saw her, she looked 3 inches taller, and she was a different person. That really small change that nobody else will really see that's happened. She looks 10 years younger, but the reason she looks younger isn't because of 1 mil of Kysense, it's because of the confidence that it's now given her. So can lip fillers look natural? Absolutely. Most people don't realise I've got quite a lot of filler in my cheeks because it hasn't been done like we see on the telly. There's a lot of famous people at the minute, a lot of celebrities out there having cheek fillers removed because they've had too many of them, and cheek and jawline and things like that, because it has fundamentally changed what they look like, and they realise they don't recognise themselves anymore, and they're all having them dissolved. And for me, that's not what I want to achieve. So for me, it is natural. It's about replacing what we've lost. It's about increasing confidence. It's not about making us look different, just more natural, and improving our own sort of to make us look as youthful as possible without looking silly. You can overdo the trying to look young thing. So to me, it is about not trying to make you look younger. It's trying to improve your confidence, which by definition makes you look younger. The last 3 questions, one of them I've actually already addressed, and that's, can men have lip fillers? Men can absolutely have all of the treatments that I offer. I might do them slightly differently, and it depends on what's asked for as well. So I do fillers on men, I certainly do botox on men, I do laser hair removal on men, and skin treatments. All of the things that we offer can be done on men as well. So there's no reason that they can't have it, but the focus might be slightly different. Lip fillers would be very, very subtle. It would be about replacing volume. If somebody had very thin lips and they wanted a little bit more volume, we could do that. It's very rare to have a guy say that they want a big pronounced Cupid's bow and sort of big juicy pout and things like that. It does happen, but it's a lot less common. And things like facial fillers, men tend to have more in the mid face, and it's about restoring youth, restoring volume, rather than changing the way that they look. And the last 2 questions, I hear this a lot, and again, I've written blogs about this before, a couple of times now. I work in an industry where I understand the terminology because that's what I do and I'm trained in it, and I understand what it is I'm talking about, and it's very easy to forget that other people don't. I'm sure everybody watching this today is working in their own industry, and you could talk to me about it, and there's lots of things I wouldn't understand about it because I don't understand the terminology, acronyms, the sort of things that we in your own industry use all the time. And the one that I realised, and I didn't appreciate it was an issue until recently, is the question that comes up, and again, this has been picked up as one of the most common questions asked online about injectable aesthetics. Sorry, it's my first day back after 2 weeks. I'm losing the ability to speak. But that question is lip filler the same as Botox? Or are fillers Botox? Is it the same as Botox? And it's something that I hadn't appreciated that people didn't know. And I don't know why I would assume that they would know, because it's my industry, not theirs, and my job is to help people understand the differences. So the answer to is lip filler Botox is no, absolutely not. They're completely different things. Botox, or botulinum toxin, Botox is a trade name. Botulinum toxin is an injected product that actually paralyzes muscles. It stops nerve endings being able to talk to muscles, and so it means that you can't move that. So you can see that I have got a little bit of movement in my forehead, not a lot. So it means that I haven't regained full use of those nerve endings talking to those muscles since I last had Botox done. The things that make your cheeks look more pronounced, plumps your lips up, irons out your smoker's lines, that's not the same thing at all. Botox, botulinum toxin, is a product to stop muscles moving, basically, whereas filler is a product but that actually ultimately leaves your body. So after it's injected, it doesn't stay where you inject it. It just has the effect on those muscles, and the body gradually reverses that. Fillers are something that stays put until the body has removed it, if that makes sense. It is a physical substance. You can see that in that syringe that I just showed you. We inject it where we want it for that volume. It also encourages water to hydrate that area. So you increase the volume, but also the real results of fillers don't happen for 2 or 3 weeks down the line. While the body settles down into it, it attracts water, it'll swell up, it'll go down. One of the things I say to my clients is in the couple of weeks, that first week or so after fillers, if you really love your lips and you think I'm fabulous because I've done a great job, you probably haven't got enough in there. If you spend the first week panicking that they're too big, it's probably the right amount, because give it a week or two and it'll all settle down to where it's going to be. And actually ultimately it can take 2 or 3 weeks really to really settle to what it's going to look like for that next few months. And with it, as I said, you're looking at anywhere between 6 months and 18 months, lips being the area that processes the filler the most quickly, and things like sort of cheeks, it tends to stay put a little bit longer. And actually science is starting to show that products do stay in the face longer than we think. So it's important that your practitioner is aware of fillers that you've had before and works around them, because you want to keep things looking as natural as possible and you don't want to overload filler into any one area. And then the last question that I've put into my blogs, and actually it's a difficult one to answer, is are lip fillers vegan? And this is something that has been asked, and it's a very common question on the internet. Excuse me. And the answer is, if you want the short answer, there it's no. But producers can be very ethical. It's a medical product, and legally all medical products have to be tested on animals. Now, with a lot of the products out there now, the ingredients have previously been tested, but none of the, so like for example, I know Kysense, none of the product that goes into these tubes has been tested on animals. It's a difficult one. Some companies are trying to move away, finding ways of moving away from that. The reality is that if you are using any medical product, there will be an element of testing to be done to make sure they're safe on humans. It's a difficult one, and strict vegans wouldn't be having any kind of aesthetic treatments at all because of the manufacturing processes. Now, I do know that the companies that I work with work as ethically as possible, and I also know that they are all finding ways to be more ethical as they move forward as well. There are products out there, there are companies out there that will that are still doing lots of routine testing that perhaps isn't as necessary now, and I know that the move is to try and move away from that as much as humanly possible. So they're the main questions that I get asked a lot. There's a lot of information around fillers. I love doing them. I love seeing the confidence that they give people. I love seeing I love the creativity of it. It was something, excuse me, that I wasn't expecting when I started doing fillers quite a while ago now. I just love seeing the difference it makes to people. If you go onto my website, if you go onto my Facebook page, you will see some before and after pictures and things that really, really very subtly give people the confidence that I'm very happy to give them. What you won't see on my pictures is massive changes. What you'll see is subtle improvements, subtle lips, softening of smokers' lines. You won't see sort of huge changes in cheeks, but if you look, you'll see differences in definition and shadowing on the face, lifting of jawlines from cheek fillers, things like that. Really subtle differences. Before and after pictures can be difficult because by definition, what I do is subtle. And some people can't see that, but do you know what? That's okay. The person concerned can see it and they get that increase in confidence, and that's what I want to achieve. But alongside that, you still need to look after your skin as well. So all of these things, without looking after your skin, only give so much. Results last longer, your skin will improve, your skin will stay younger longer if you do the right things on your skin as well. So hopefully I've answered those questions. And those of you who joined late, the questions that we've answered are lip fillers safe? Are lip fillers permanent and can they be removed? How lip fillers are, how do we do fillers? You know, what products do we use? What equipment do we use? And in fact, just a little note on that one, there's a lot of people doing fillers, and I think one of the most important things is their processes and how those things are done. And medical people are trained in things like aseptic technique and how those to do those sort of very clinical processes properly, and I think that's really, really important. The other questions were, can lip fillers look natural? Can men have lip fillers? Is lip filler or are fillers botox, or are they the same as botox? And are they vegan? So I think I've hopefully answered that. I don't know how many that's 1, 2, 3, 4, 5, 6, top 8 questions that either I get asked or are most commonly asked out there on the internet. I think hopefully I've answered quite a lot of those for you. Funnily enough, I've got a client due to come in any minute for some lip fillers, so I am going to go and leave you with that. But if anybody does have any questions, do ping them either in the comments below the video, or feel free to message me on the business page, and I will get back to you hopefully later on this evening. And I hope that's been useful. But if you've got any questions, please do tell me. If anyone can give some thumbs up, that would be really lovely as well. Just to let me know that you're out there. And I will upload this video to YouTube later on as well, so it's easier to find if anybody wants to know anything about some fillers. And if you want to book, you know where I am. It's Sally Wagstaff Aesthetics. I'm in Bowley Park in Lichfield, and you can book by just pinging me a message and we can sort something out for you. Hope that's been useful, and I would love to see you all in clinic for some fillers. Have a great day. See you later.